Hey, you guys, I am literally inside the US Senate right now, but I have to come online and talk about this. Most of the hospitals in Southern California have been on a hiring freeze for months now. However, University of California, San Diego sent out an email to all staff yesterday that they were laying off 230 healthcare workers. They said in the email that this has nothing to do with performance and is entirely because of budget cuts. That's right, you guys. California hospitals are laying off healthcare workers because of the potential budget cuts in the big, beautiful bill that Republicans are trying to shove through Congress right now. We're already feeling it. We are already feeling it. And we are going to continue to feel worse. Reminder, this bill has not passed yet. However, the hospitals are acting preemptively and firing healthcare workers. This is bad. This is bad for you. This is bad for your mama. This is bad for your grandma. This is bad for everyone. This is bad for nurses. And we have to fight against this. And what that means is calling our senators. The bill passed the House of Representatives. That means it is now up to the Senate to decide if it goes further. So we have to be calling our senators as much as we can or emailing them. Shit, I'm in Washington, D.C. This is the people's house, okay? You can just show up here. Knock on an office door, okay? Republicans want to cut $1 trillion. $1 trillion from Medicaid and another $500 billion from Medicare. These cuts are going to directly affect us, and they are already affecting us, and the bill hasn't even passed yet. Laying off nurses, laying off healthcare workers, laying off hospital staff is bad. It means shittier care because, simply put, we can't be everywhere at once. It means longer wait times for care in the ER. It means higher costs. It means our entire community suffers. As a nurse, I cannot tell you how serious this is. I cannot tell you how sad it is that 230 healthcare workers at University of California, San Diego are now not going to know where their bills are going to be paid from because that hospital has preemptively cut staff because of these potential budget cuts. We have to fight for our communities. We've got to show up, call your senators, knock on their damn office doors, email them. I don't give a shit, girl. Just get a hold of them, okay? We got to stop this bill. We got to stop this fucking bill. We got to protect Medicaid. We got to protect Medicare. We need to expand, actually, both of those programs, because if we don't, our communities will suffer. The only reason they are doing this is to create tax cuts for billionaires. I say fuck that. I hope you do too. And I hope you join me in fighting this.
Kept saying that their healthcare cuts wouldn't hurt anybody right away. Well, they lied. It turns out hospitals are already closing, people are already losing their health insurance, and it's only been 2 weeks since Trump signed the bill. To start with, some Planned Parenthood clinics are already turning away Medicaid patients. In one region, they said they can't see these patients at all, even if they pay out of pocket. UCare in Minnesota just dropped 88,000 patients from Medicaid coverage. Curtis Medical Center in Nebraska closed. Lady of the Angels Hospital in Louisiana about to close. Garnet Health in New York laid off 42 people and cut diabetes and lung rehab services. Providence Healthcare, one of the biggest hospital chains in America, just cut 600 jobs across 7 states specifically because of these federal cuts. UC San Diego Health laid off 230 workers. Community health centers are looking at closing 1,800 locations and cutting 34,000 jobs. These are the clinics that serve the poorest communities. Think you're safe because you have private insurance? Think again. Blue Cross Blue Shield in Illinois wants to raise premiums by 27% next year. Texas Blue Cross wants 21%. Washington, Georgia, Rhode Island, all over 20%. And here's the kicker. The subsidies that help people afford Obama.
When I kept going through those bouts of unemployment, it was like, I don't know, like I wanted to die. I was extremely depressed. It was really hard. I thought that I would never recover from these things. And I don't know, when I would get laid off and then get a job again and then get laid off again, I was just like Christ. So yeah, it's I don't know, a big deal that I've had this continuity because I haven't for the past 5 years held a job for more than a year.
People think I have health insurance, so I'll get the health care I need. Wrong. Having insurance doesn't mean you'll actually get care. Your doctor could know exactly what you need. The right medication, the right scan, the right treatment. but your insurance company can still say no. For example, say you need an MRI. Your insurance can make you wait weeks for a prior authorization. Or your doctor prescribes the best drug for you, but your insurance company forces the doctor to prove that you failed 2 cheaper medication options first. Even if the insurance company ends up approving the more expensive medication, insane copays and deductibles prevent people from filling the medication. Patients end up delaying care, and by the time they're finally treated, their disease is already worse. Unfortunately, the United States healthcare system is not proactive, it's reactive. It doesn't reward prevention or early treatment. It waits until you're sick enough to be profitable. And here's what really bothers me. Insurance companies basically run the healthcare industry, but they're not the ones with the medical degrees. How are they the ones making care decisions? People love to say that doctors profit from keeping you sick. That is absolutely false. Doctors want you to be healthy. They don't make any more money from you being sick. Who actually profits off Americans being sick? Insurance companies, because they collect premiums even when they're denying you care. The pharmaceutical companies, because they're the ones selling you the drugs. And big hospital systems, because they get paid more for admissions and ICU stays and surgeries than preventative care. That is where the money goes, not into the pockets of doctors. Insurance is not healthcare, yet it runs healthcare, and patients are the ones paying the price. At the end of the day, insurance companies are businesses with business mindsets. It's heartbreaking because as medical students, we get closer and closer to the medical system and we see all the brokenness within it. And it truly is heartbreaking because we are the ones that want patients to get better, but we are the ones that are denied helping our own patients.
Yeah. So, California made healthcare free for illegals.
Yeah.
As of last year. So, and that obviously that's a gigantic magnet for more illegals. And this is not a thing you can solve simply with money, because what happens is you simply have more patients than a doctor can possibly see, and you can't just make doctors out of nothing.
David Valadeo just voted to rip away healthcare from 65,000 people here in California Central Valley, and I'm furious. I grew up here in the Valley. I grew up on Medicaid. I know what it means for a working family, for an aging parent, for a sick child who depends on Medicaid. And Valadeo sold us out in order to give tax breaks to his billionaire donors and corporate sponsors. We deserve better than that here in the Valley. My name is Randy Villegas. I'm a professor, a school board member, and someone who's going to fight like hell for our Valley residents. Because we deserve somebody who's going to show up to Washington, D.C. and fight for us like their lives depend on it. Because here in the Central Valley, they do. So please, tap the link in my bio to help us win. The fight isn't over. We're just getting started.
Hey everyone, quick update you need to hear. San Diego-based Sharp Healthcare just announced that they're laying off 315 employees, which is about 1.5% of their workforce. This includes senior executives and roles in medical information and marketing. So what's driving these cuts? According to Sharp, the rising cost of healthcare is outpacing revenue. They are also facing state-mandated seismic upgrades and poor reimbursement rates from payers. So bottom line, they say they can't keep up with the economics. Here's what else is changing. Some staff will see reduced hours and others will be moved into adjusted roles. Sharp says the majority of cuts are in non-clinical areas, so direct patient care won't take much of a hit. Leadership is also fearing the squeeze. Senior execs are taking a 15% pay cut, and the CEO, Chris Howard, is trimming another 10% off of his own salary. So now Sharp is offering severance, extended health care, and career transition support for those impacted, which is better than what some other systems that I've reported have offered. But still, this is a signal that no health system is immune, especially if you're in a non-clinical or even in an administrative role. If you're a nurse or allied health professional thinking your job is secure just because you're not at the bedside, this is your warning shot. So let me know, definitely in the comments, Are you seeing cuts at your facility too? And if you're in a non-clinical role, are you making moves to protect your career?
I just finished my appointment right now. Literally took 5 minutes today. I am so happy. So for this appointment, I charged $180. My appointment was at 10:30 and it is 10:39, but I got out at 10:36. Well, let's say 6 minutes, not 5. But anyway, guys, my next appointment is at 3 p.m. 3 p.m., which means I have approximately 4.5 hours to do what? I don't know. I'm probably going to go have lunch and then I'm going to maybe go coupon a little bit more because, oh, I forgot. Before going to my appointment, guess what? There is a Walgreens next door, literally. And look what I got, guys. Look what I got. $1.25 a piece. $1.25. And here it is. $1.25. I got 2 of them. Where's the other one? Right here. $1.25. This is why I love to do what I do because guess what? I have a lot of time to go couponing. But then sometimes I do get bored. Sometimes, guys. So I am going to tell you the reality of being a medical interpreter. Sometimes it does get boring. But I mean, you just got to find what to do. But besides couponing, guys, what would you guys do if you guys were in my situation and had 4.5 hours in between the work appointments? Where would you guys go? Because sometimes I kind of want to switch it up a little bit. I mean, I do go have lunch, coupon, but I don't know. I want to do something else, but I'll see what I do. Anyway, guys, if you guys want to learn more about medical interpreting, you guys can check out the rest of my videos. Why is the light? Oh, because the sun's hitting my face. Look, half light, half dark. There you go. Anyways, or you guys can go research on Google. I don't know, wherever you guys find it more trustworthy and find out about this wonderful, amazing career. Bye now.
I got laid off yesterday and I'm literally shaking talking about this. I really debated whether or not I was going to even post about this. And I decided ultimately that this is probably a journey that I should share with you guys, especially because of the macroeconomic environment right now. There are a lot of layoffs happening. So if you have gone through a layoff recently, I'm right there with you. Majority of yesterday to obviously process what had happened, especially because it came out of nowhere. Absolutely no warning was provided. A meeting was just put on my calendar the day of for 3:30, and my manager and HR hopped on the call and they literally said, "We're going to have to let you go. We're tightening some things up." Surprisingly, I did not cry. It was obviously very disappointing, but honestly, I had felt like I was not in the right place for the majority of the past year that I had been in this job, but I had been pretty much trying to force it. And I think the universe was definitely just saying, "Grace, it is time for you to move on." I also definitely had an identity crisis. If you guys know me, you know that I take a lot of pride and joy in my ability to be a really hard worker and a good worker as well. In the company that I was at previous to this company, I was a top performer. I literally closed 100% of my deals. Like, a big part of my identity, it does lie in being really good at my job. And I'm realizing that that's probably something that I should work to take out of my identity, because at the end of the day, we are so much more than our jobs. There is a saying that basically says, if a flower is not blooming, you don't change the flower, you move the environment that it's in. And I think the reason that I'm able to take this so calmly is because I know that something really amazing is about to come my way. I think that if something similar has happened to you, it's really important right now for you not to take this personally. It is not your fault if a company is not able to effectively manage their finances or has overhired or any other issues that ultimately trickle down to you being let go from the company. And I think that this is an important lesson that all of us are learning this year, and I'm definitely seeing a trend in all types of employees taking a lot of ownership in maintaining work-life balance and making sure that their job doesn't take up a majority of their life, which I personally love. If you guys have been following me in the past 2 months, you know that I have been taking a lot of intentional action to make sure that I'm building a consistent and disciplined lifestyle that aligns with the type of woman that I want to be. And this was just another aligned action that I unfortunately was not expecting at all to come my way. But I guess now I can look at it as a pleasant surprise. When something like this happens in your life and it makes you feel like you have officially hit rock bottom, you have a pivotal choice to make in this type of moment. You have the ability and the freedom in this moment to make a choice that comes next that will put you either in the right direction that you're supposed to go or keep you stagnant. I know I'm personally taking the next few days to really reflect on what I want for the rest of my life and make sure that whatever opportunity I take next really aligns with what I know I'm supposed to do. I'm really excited to see what comes next. I actually already have a couple of opportunities lined up, which I'm super grateful for. But I definitely want to make sure that I'm making the right decision for whatever comes next, because this past decision that I made obviously was not the best one that I should have taken on. But we live and we learn. And I'm super excited because I feel like the world is my oyster at this point. Like, I have the freedom to be able to make a really, really important decision. And that's not something that I'm taking lightly in any way. I will be sharing about this process because I think that it helps to be able to share and be able to connect with people who are also going through it. So if you are also going through something like this, feel free to send me a message. Let's talk about it. I've been talking with so many people over the past day, and it has helped a lot. So if anything, make sure that you reach out to your support system and do not try to take on this alone. It is very important for you to be supported, especially during a time like this.
So I got laid off today. I'm a registered nurse. I've been a registered nurse for 3 years. I've been a home health nurse for the past year. Alongside being a home health nurse, I've also been a healthcare coach remotely. A few weeks ago, I was laid off from my second job as a healthcare coach due to Medicaid cuts. Today, I was laid off from my agency due to my client being cut from Medicaid. Mind you, this is healthcare, one of the most lucrative, job-secure fields that you could possibly have. And here we are, having nurses and doctors being laid off left to right under this administration. And if you ask me, this is only the beginning. If we don't do something now, things are going to get worse after this. You have groceries increase, gas increase, bills increase, unemployment increase. This is crazy. This is crazy. And something really needs to be done.
By the way, more layoffs adopted today. Getting reports of an office closed in California, and Optum RX laying off initial employees. Feel free to check the Warren Act to see if these are at a reportable scale.
First off, I'm a veteran, and Trump's Secretary of Veterans Affairs, Doug Collins, has decided that the best way to honor our veterans is by slashing 83,000 jobs. That's right, 83,000. And that's not just a number. That's over 80,000 hardworking individuals, many of whom are veterans themselves, who have dedicated their lives to serving those who served us. And Collins thinks the best way to improve efficiency is to fire them. This move isn't just reckless. It's dangerous to veterans. Veterans' health care and benefits have already been stretched thin. The PACT Act expanded care to millions, but now Collins wants to roll back these gains. He's claiming these cuts won't affect services, but that's blatantly dishonest. Reducing the workforce means longer wait times and fewer appointments and less support for our veterans. And let's not forget the hypocrisy. Collins is cutting jobs while praising himself for saving money. But what about the cost to our veterans? What about the cost to the dedicated employees who are being shown the door? This isn't about efficiency. It's about abandoning those who have already given so much and for the sole purpose to give billionaires a tax break. Unbelievable.
They took away lifetime maximums. It's enrollment period for my healthcare at my employer. We do it every year. They tell you what changed in your benefits package, and it looks like all 4 of my healthcare options no longer have a lifetime maximum. So here's how it went. 10 years ago, I had a friend of mine get cancer, and she racked up about a little over $1 million of cancer treatment care to save her life, and she's alive today, which is great. But those costs totaled over $1 million, and she hit the lifetime maximum for her plan. And she had to pay $0 after hitting that. It's gone. Now it's auto-pocket max every year, which resets at the beginning of every year. And so you hit your $5,000 for the year. They cover a little bit more, but not that much in the world of healthcare nowadays. You'll still get $500 bills here and there. And then it resets next year, and you got to do it all over again. Only in America does this happen. Other countries have figured this out.
I thought nursing in America had the greatest job security. Turns out I was wrong. A new hire who was training with us today actually told me she was laid off from Providence, along with multiple other nurses and a couple pharmacists back in July. And what's wild to me is this is not the first story of layoffs I've heard happening in healthcare. It seems to be happening all over the country. And I'm really curious to know, why is this happening?
America's healthcare system is junk, but I think that most of you know that. So I'm going to regale you with a little bit of a tale that happened to me just now. So it is August 18th, 2025. I gave birth to my daughter August 4th of 2019. Okay, so 6 years ago, almost to the day. And they, billed, and it was like $4,000. We were paying it off, and, it was taking a long time using our HSA account. Then our HSA funds ran out, and we applied for the hospital forgiveness or whatever. And after that, no, I didn't do my due diligence, like following up or whatever, but we stopped getting phone calls from them. They stopped taking payments. And what have you, and we never heard from them again. So I thought, oh, well, maybe they really did wipe out that debt. It's like their charity thing or whatever. Maybe they, good faith, we made payments and all that stuff. So, hold on. Sorry, I wanted to stop shaking you guys. So I thought, maybe they were like, oh, good faith. They made like, $3,000 worth of payments. Yeah, let's write it off or whatever. Well, I never heard from them after that. So fast forward to today, I get a phone call from a law office, and I look them up, and they're legit. They buy medical debt, etc. You get those scary ones, law office, blah, blah, blah. So I called back the lady, and I was like, well, I'll just get into a payment plan on my HSA or something. And she's like, you owe this debt. I'm like, okay, yeah, I guess I thought I had been wiped out. It wasn't on my credit. I thought that it had been taken care of, but, I'm willing to make payments on it or whatever. And she's like, well, I can offer you $110 a month for 10 months. And I said, that's fine. I'll put it on my HSA card. And she's like, okay. And I was like, well, wait, I need to make sure that as long as I'm making payments, it's not going on my credit, because, I don't have the full amount to pay in full. I do technically, but I'm having a medical procedure where they're checking for some girl stuff that, I'm 43 and I've been having some irregular issues going on. And so they're going to do an ultrasound to check and blah, blah, blah. But I haven't met our huge deductible yet, which is $3,600. For this year. So my ultrasound is going to be $700 something to check out what's going on, what might be wrong. And in our HSA, I'm looking at it right now, we have $1,315.63. So I told her, I said, well, I really don't want it to go on my credit, because we're trying to move. We're trying to buy a house, sell our old house and buy a new one. I really need it to not go on my credit report, but I need to make sure that as of the end of this month, I still have $700 in my HSA. So if I make the payments, I need to make sure that it won't go on my credit report. And she's like, well, I'll talk to my boss or whatever, supervisor. And she said, nope, the only way that you can avoid it going on your credit report is to pay it in full. And I'm like, I can pay more than the $110 a month. I can pay $300 a month. I can pay $500 a month. That's fine. I just need to make sure that at the end of this month, I still have the $700 in my HSA to get this procedure that is checking for things to make sure I'm okay. She's like, I understand. Let me ask another supervisor. And she's like, no, you have to pay it in full in order for it to not go on our credit report. We've been working very hard on our credit scores. I've got an 800 and my husband has like an 815 or something. So we've been working really hard to get a house and get a good, the best interest rate we can, etc. We've really been working hard. And I'm like, do you not understand that I have a medical procedure that I have to have and you're making me choose? Like, you're making me choose between paying this balance that I thought was taken care of. It was never on my credit. I hadn't gotten any phone calls. She's like, well, we tried to contact you July 7th through the mail. And I'm like, I have an $11,000, freaking insurance check on the way for an under the house leak that didn't make it. I had to have them cancel the check and try to resend it because I'm not getting stuff. I'm not lying. I didn't get your stupid letter, Well, we did try to contact you. I'm like, a month ago. Wouldn't you think that if I didn't answer your snail mail that maybe you should have called me? Well, we tried to get in contact with you. I said, well, you left a voicemail this time. I've never had another voicemail. That's why I called you back. So I don't answer stupid numbers or strange numbers that I don't know. So if y'all didn't leave a voice message, that's your fault. Like, that's not on me. I thought this medical debt was taken care of. It's not like I've been ignoring it. I thought it had been written off by the hospital charity thing. So I paid it. But now I have to postpone my medical procedure. So this is the beauty of healthcare in America. And you can come at me and say, well, you should have taken care of it. We did. We just didn't have $4,300. My entire hospital bill was like $48,000. And then I still owe from my son who I had in 2023. So that's the beauty of having a high deductible plan, which is $3,600. And the beauty of paying 80/20, because 20% sounds like a great deal and insurance takes care of 80%, but it's really not. If your hospital bill is $48,000, you owe 20% of $48,000. American, and you pay the deductible. I think I did some math, and by the end of the year, with our insurance premiums plus our deductible, we end up paying like $10,000 a year in health insurance. So, yeah. So now I have to postpone my medical procedure and hope that everything's okay. It took me 3 months to get this appointment.
Thank you for watching Great Minds Blacks.